So hi, good morning. So right now I'm gonna perform inline aerosol. So once we do an inline aerosol, first and foremost, always make sure we check the patient's chart, especially if there are any recent orders, and then take note that the medication should be with us already, and double check the medication. Once you're about to go inside, wash of course our hands, introduce ourselves, even though the patient's unconscious, maybe, or there might be a patient, a relative inside. Reassess of course, as always, try to listen to the breath sounds before doing an inline aerosol. Try to check the other vital signs such as the SpO2, heart rate, and respiratory rate. And then once you're about to go, first and foremost, once you try to do an inline aerosol, make sure you try to suction if there are any secretions present. Try to clear it up, and then once you're all done with that, we can try to do an inline aerosol. So with this, we have a ventilator. Just everything should be assumed. So assuming this one is being hooked up on a ventilator. So with the inline aerosol, usually it has a T adapter in it. Make sure that this is inserted on the inspiratory limb. So just assuming it's because it's just a single limb, so we just have to assume this is an inspiratory limb. So with this, it should be inserted in here in front, like that. So once you do this one, it should be inserted tightly and secured. Sorry about that. And then we have the nebulization in here on this side. So with the nebulization treatment, make sure that once you, especially if this one is the patient intubated, make sure that you position the T adapter like this on an upright so that it will give adequate mist or medication. We should prevent from positioning it like on sideways or even downwards, as long as it's just upright. So another thing is that when we do inline aerosol, is that for example, if we've got patients who are being put on HME, so make sure that the HME should be removed, because the reason is if we give nebulization with an HME, it would lead the medication being stuck on the HME, so it will lead no benefit to the patient. So for example, this blue thing, which is the flow sensor, let's just assume this one is the HME. So if this is the patient on HME and your doctor would like you to give a nebulization treatment, all we have to do is remove the HME and insert it the T adapter. So that way we can start on giving the nebulization treatment. So for example, that the patient on HME, you already give the nebulization treatment or the aerosol treatment. Once you're all done, remove the T adapter and then put back the HME again. And then hook it up like that. So with this ventilator, for example, we're gonna give a nebulization treatment. So with this, we have a sign on it on the ventilator with this mist kind of thing. All you have to do is just press it, and then you can see this green light. And then another thing is you can also hear there's a hissing sound on this canister, so that you will know that there is medication that was being given. So another thing to note also when giving nebulization treatment is that the parameters, it might also try to affect quite a bit, because it might be because of this medication that was being given. And then once you're all done, once the medication is gone, the mist is gone, of course you have to turn this one off. And then once you're ready to give them nebulization treatment, of course, one of the important things to take note is try to look at the parameters, especially for the peak pressure. As what you've seen, there's a alarm pressure limit, so try to take note. There might be secretions on the patient's airway. Try to suction, especially it's just being loosened up right after nebulization treatment. Try to listen to the breath sounds, auscultate, listen to it, and then try to observe the side effects of the treatment. Try to check the vital signs, SpO2, heart rate, respiratory rate, and everything. And then once you're all set and everything is all done, once you already did suctioning part, remove the PPE, wash your hands, and then make sure once you're about to go outside, try to document everything what you're trying to do, explain it to the nurse, and then if the physician is present, also make sure you explain it to them.